Hi, I'm Jessie Davis, and I want to show you how I would treat the functional and soft tissue elements of neck and shoulder pain, as well as show you a few exercises that you can start to implement into your daily schedule in order to help rebalance your posture. With Morgan, you'll notice that she has the typical posture of somebody sitting at a desk all day. Her chest muscles are shortened, her shoulders are rotated internally and shrugged up. As well, her chin is poked forward, causing tightness at the base of her skull, as well as weak, deep neck flexors. Typically, we'll use a variety of techniques to treat this condition, such as active release techniques, soft tissue, and myofascial release. We'll start with pecs, lats, rotator cuff, and cervical extensors. Two muscles that really cause the shoulders to appear rotated forward are the pecs and the lats. So we'll start by releasing the pecs. We'll do this by applying pressure to the pec muscle, shortening it, and then stretching it as we keep the pressure. We'll do this for about 3 to 5 times, or until we feel the muscle start to release. To release up her lats, along with her teres muscles, we'll start with her lying on the side. We'll apply a broad pressure into the muscle, start with her shortened, and stretch the muscle. As before, we'll do about 3 to 5 passes or until we start to feel the muscle release. In order to complete the functional component of this treatment, we'll also need to implement a home exercise program that can be completed daily. We'll start with a Peck Stretch. So to do that, we'll have Morgan face the wall and put her hand on the wall. She's going to aim to be a little bit above shoulder height, and she's going to turn her body away from the wall in order to stretch the front of her chest. She's going to want to make sure that her shoulder is dropped. However, if you have shoulder impingement when you try to bring the arm this high, you can just bring the arm lower to a point that's a little bit more comfortable. With this, you're going to want to hold it for 30 seconds and repeat it twice on each side. To stretch out her lats, we'll get her to start in a kneeling position with her hips sitting right back on her heels. She's going to slowly reach forward, trying to get her chest and her face as close to the floor as possible. With this, she should be feeling the stretch along the back into the arms. If she wants to increase the stretch on either side, she would reach to the opposite. So to stretch out her left side, she'll reach to the right, and to stretch out the right side, she'll reach to the left. With this, she'll want to repeat each 30 seconds, twice on each side. Next, we're going to stretch out her suboccipital muscles, which are the small muscles at the base of her skull. She's going to start in her natural position, which starts with her chin poked forward. She's going to slowly bring her chin back into her throat, trying to flatten out the base of her neck. She's going to hold this for about 2 to 3 seconds, and then she's going to slowly release. She'll want to repeat that 10 times and do 2 sets of that. Our last stretch is an active stretch for her thoracic spine. She's going to want to start lying on her side with her leg propped up on something. We've used a foam roller here, but you can use a cushion or a few pillows to keep the knee in line with the hip. From here, she's going to look at her hand and slowly open her arm up towards the ceiling. Once her arm's in line with her chest, she's going to twist her upper back towards the floor. She's going to pause here for 1 second and slowly come back to the start. She's going to want to repeat this 10 times and perform 2 sets on each side. And there's 4 stretches that you can start to implement into your daily routine to keep your chest, lats, neck, and thoracic spine nice and mobile.